So today we will deal with healing wounds with words, the emotional toll of medical interpreting in Iraq. I chose this title on purpose because, as you can see, the title gives you an idea about what the medical interpreter can do. Sometimes he can somehow heal wounds with his words that he uses with dealing with patients. Now, first, let's talk about this four important, let's say, points in this presentation. We will deal what medical interpreting is, and we will see what is the emotional toll and the psychological strain that affects the medical interpreter, and we will answer the question of how to avoid this emotional toll, and we will see some recommendations for a movement. Now, at first, medical interpreting is not just mediating or facilitating words between the healthcare providers and patients. It's more than that. It involves more than just mediating words. It requires many skills and many things to do from the interpreter. For example, we have a study involving Arab migrant cancer survivors revealed that patients felt their interpreters were not always attentive and leading to feelings of being unheard. Of course, one of the roles of the interpreter is to hear carefully for the patients in order not to harm them, their feelings, or they shouldn't feel neglected by the interpreter in order to, let's say, complete the interpreting process carefully. Now, second, about the emotional and the psychological strain, interpreters are regularly exposed to traumatic stories, especially in Iraq. Medical interpreters often work with populations affected by war, traumatic stories sometimes, and poverty. And as we know, there are a lot of traumatic stories happen in Iraq. And when an interpreter is trying to interpret these traumatic news or bad news from the patient's experience, he should be carefully dealing with that interpreting without harming himself, affecting himself emotionally, or harming the feelings of the patient. Now, a female Arabic interpreter in Baghdad assists with maternity care for refugee women. Without the access to this psychological support, she begins to experience sleep disturbances and emotional numbness. Here comes the need for, let's say, psychological support for the medical interpreters, and let's say training systems in Iraq need to be facilitated in order to help the interpreters avoid this emotional toll from happening. Now, the key issue here is that Iraq lacks a training system and formal support system for medical interpreters experiencing emotional toll. Now, how to avoid this emotional toll from happening? By maintaining professional neutrality, by protecting their mental well-being, by avoiding emotional entanglement, by recognizing boundaries between interpreting and offering emotional support. And offering emotional support, it is not the role of the medical interpreter, and the self-awareness of emotional triggers. Now, one of these important let's say, points of how to avoid the emotional toll is how to recognize boundaries between interpreting and offering the emotional support. I have these three simple steps to follow in order to the interpreter to, let's say, save himself or from the emotional toll to happen. First, he should talk to the doctor first or the healthcare provider in order to have the full information of the case. Is it a normal case? Is it a normal patient, or somehow he is a cancer patient, unfortunately will die after a month? He should have the full information of the case and should ask if there any special treatment for this patient. Second, after having the full information of the patient, the doctor should the interpreter should interpret the instructions carefully. Of course, he should avoid harsh language while dealing with the patient. For example, if the doctor said to the interpreter to say that her father is dead, unfortunately, he can't just say أبوك توفى أو أبوك مات. It is so shocking news to hear and will affect the emotions of the patient. He should use very gentle words. For example, البقاء لله, البقية في حياتك. Or in English, he can say, unfortunately, doctors did everything they can, but we have lost him. And after finishing the interpreting process, the third and final step is that the interpreter should not engage with the patients emotionally or personally. Sometimes the patients try to make a friendship with the interpreter, and sometimes they ask for an email or for his number, and it is not an unprofessional thing to do, and he should refuse doing that. Now, by applying these 3 simple steps, the medical interpreter can help himself or prevent himself from having an emotional toll. Now, all of us knows that Iraq have a diversity of languages. There are populations that speaks many languages, for example, Turkish, Arabic, Kurdish, and English. And because of that, there is a need for medical interpreters that can facilitate all these languages and concentrate on the cultural side that affect any type of interpreting or translating. And a documented case involved an Iraqi Muslim woman who was asked to remove her hijab during a medical exam in front of male technicians. The interpreter here stepped in and explained her religious obligations and requested accommodations. Now, if the interpreter didn't know or didn't have any cultural background about the patient or the healthcare providers both, and without stepping in, maybe the Muslim woman will be obliged to remove her hijab, and this will affect her emotionally and will make some disturbances between both sides. Now, he helped both sides with, he didn't make her to remove her hijab, and he explained how Muslim women wear her hijab, and it is not okay for us to remove our hijab even in hospitals. Now, this is why cultural, let's say the cultural background of, knowing the cultural background of both sides is important, and dealing with culture in interpreting. Now, how to improve medical interpreting? By standardized training programs, by setting professional boundaries, and we should know about the stigma around mental health. We all know that in Iraq, people somehow think that the person that goes to a psychologist is somehow crazy. And it is not necessarily true, because anyone can go in to a psychologist and ask for a psychological help. And the interpreter, medical interpreter, if he felt that he is emotionally, let's say, infected, he could just go to a psychologist and try to get his help. Now, as a conclusion, we all know that medical interpreters in Iraq face serious, systematic, and ethical challenges due to linguistic diversity, cultural complexity, and emotional exposure. And by addressing these techniques and challenges and implementing the recommended strategies, Iraq can enhance the effectiveness of medical interpreters, leading to improved patient care and a more supportive environment for medical interpreters, which can enhance the results of interpreting significantly. And that's all for today. Thank you so much.